So, Gautami, thank you so much for joining us on the patient story to share your story.
Awesome. Thank you for having me.
So, yeah, let's get right to it. At the time you're much younger, in school. How did you know something was wrong?
Because I was so young, I thought everything was fine and I was normal. It was really my mum that noticed that my abdomen was getting quite swollen. So apart from that, I didn't really have any other symptoms. But because of that, I was losing a lot of weight everywhere else except for my abdomen. And that's basically what prompted us to visit our general practitioner.
So there were no other symptoms other than your abdomen area was bloating, it was getting bigger. Everywhere else you were losing weight. Was it that noticeable?
Yeah, it was pretty noticeable. Like, honestly, I think looking back, I looked like 3 months pregnant-ish, and that was obviously not very normal for someone who's 13 years old.
Gotcha. Okay, so describe to me the process. You go to your primary care doctor. What happens then?
So I went to my GP, and then my GP basically, you could tell it instant.
Um, okay, so you froze for a second. If you could start again with you went to your GP.
Yep. So sorry, it just froze for me as well. I went to my GP, and then she instantly kind of knew something was wrong, and I could tell based on her face. And she palpated my abdomen, and she said that I had to go to the emergency department, and that something was really wrong. So basically, from there, we went straight home, packed an overnight bag, and went straight to the hospital.
Wow, that happened so quickly. And so she basically was just touching around the outside of your abdomen area.
Yeah, yeah, that's all she did. And yeah, just because it was so swollen, and she said that she could definitely feel like there was something inside, whether that was fluid or a cyst, or she didn't specify, but I think that was kind of where the train of thought was going.
Okay, so you headed to the hospital right that day, that same
Yeah,
day.
yeah.
Can you just,
So
yeah, go ahead and describe that.
yeah, so we got to the emergency department, and like I said, I was still feeling pretty healthy and fine for the most part. So it didn't really feel like anything was wrong. And we waited in the emergency department for a couple of hours, and then we went in, had a blood test, a urine test. They asked me a whole bunch of questions, and like I said, because I felt fine, I kind of was answering no to all of the questions they were asking me. And then they said I was going to have an ultrasound, but because they were a bit worried, I instead had a CT scan. And by this point, it's probably about 12 at night. And so I had my CT scan. And after that, I came back, went to sleep. And then the next morning is when they told me that they had to do surgery.
Wow, that was so quick. So you were at the hospital this whole time. So you wake up in the hospital bed and get the news?
Yeah, yeah. So woke up early the next morning. Then I had two doctors come in and sit me down with my parents and basically say they found a cyst on my right ovary and that they had to remove it the next day because they were just worried about the size of it. And yeah.
I know this was a few years back, but can you describe sort of what was going through your head and how your parents are reacting at this point?
Well, I actually spoke to my mum about this, and she said, because she came with me to get my CT scan, my dad, I think, was sleeping. And she said she saw the doctors looking at the scan results and they just looked like shocked. And so she kind of knew then that something was wrong. But when they were telling me, my parents were obviously really upset, and that's how I knew something was wrong. But I felt really calm, and I don't know if that's because I was 13 and I couldn't really take in the full gravity of the situation. So I remember the doctors telling me, I just said, okay, that sounds good. And they looked at me and they were like, do you understand what we're saying to you? Like, can you repeat it back to me just to make sure? But I think I felt relatively calm and okay. And I think just being so young, that kind of protected me from, truly feeling the emotions that I was supposed to be feeling then. And just, I guess, the shock as well, because like I said, things had happened so quickly and I still felt fine. So I think that made me feel like it was going to be okay.
Gotcha. At that point, before surgery, what did they know at that point? They knew it was ovarian cancer? Did they know the subtype?
No, no. So they didn't know it was cancer. I don't know if they had any inclination to believe that. All they told me was that there's a cyst and they were going to remove it. And I know that there was a plan to take a biopsy from it as well.
Okay, can you walk us? Okay, so that's early morning, you're hit with this news, you're relatively calm actually. Um, did the biopsy happen that day? What were the next steps?
So from there, I just got moved to a different ward, and so the next day was when I was supposed to have my surgery. And so I woke up the following day, got wheeled straight into surgery, talked to the surgeons and nurses before I went in. And yeah, so that's when I had the surgery to remove the cyst. And they also ended up removing my right ovary. And also that's when they took the biopsy.
How do you remember how long that all was? And I'm assuming you were asleep at this time, of course.
Yeah. When I had the surgery,
Right? How long the surgery lasted, and how you woke up.
I think it was about 6 hours long. And I remember waking up and it was just the most drowsy I've ever felt in my life because I was on full anesthetic. And I also had an epidural and morphine. So I was really drugged up. And I remember waking up and I just felt the most intense pain in my abdomen. And I just remember crying because of how painful it was. And there was heaps of people surrounding me as well. I had all my family and all of my extended family there in the hospital room as well. And it was all a very intense experience. But yeah, they sorted out my medication and I started feeling a little bit better. And I was basically numb for half of my body because of the epidural. So I couldn't feel too much as well.
So they gave you the epidural after, or
Yeah, after the surgery.
to help with the pain,
Yeah,
essentially.
yeah.
Okay. Do you remember how long that lasted, the painkillers, and how long your pain lasted in general?
I But yeah, so the pain didn't last too long because as soon as they adjusted the medication, I felt better, and I had that for about a week, I think, and then they took out the epidural, and they lowered the doses of morphine as well.
Okay, gotcha. So for, would you say, I'm sorry, a couple days then, or?
Yeah, I'd say about a couple days.
Okay, and you, so you had to recover from the surgery for how many days?
I was in hospital for about 3 weeks.
Okay, wow, from the start to the finish. So before we go any farther, I know that you said you woke up and it was pretty intense, is the word you used. There were a lot of people around you. I think for some people that's a great thing, it's comforting, and for others it's overwhelming. So
Yeah.
do you have any advice to people about, like, hey, if you are going to do this, maybe have conversations before about, we can't have too many people, or, I don't know, like ways to make it less overwhelming for the patient?
Yeah, that's such an interesting question because no one's asked me that before. But yeah, I think when someone's unwell, you obviously want to be there for them and you want to know that it's going to be okay. But I think just holding off on that's important because, yeah, it definitely was overwhelming as much as I appreciated it. In that moment of being so drugged up and in pain, that's not what I wanted at the time, as much as I loved and appreciated everyone that was there for me. And I think possibly just coming in a bit later or waiting or coming in one at a time would have been a lot nicer experience for me. And I think the support is very, very important because I don't think I could have gotten through those 3 weeks without having visitors constantly pouring into my room. But I think right at that initial stage, it is important just to give a little bit of space while I was just recovering from the intensity of it and just getting used to the fact that, I was in hospital and just because of how fast things had happened, I needed time just to adjust. And yeah.
And process, yeah. So what I'm hearing from you is, people have different maybe desires in terms of what kind of support they want, but it's important to understand you need a little breathing room, especially in the beginning as you're recovering, and maybe just to have those conversations beforehand so that people understand your point of view.
Yeah, definitely. Yeah. So just giving people space in the room to adjust and heal and process everything that they're going through and is, yeah, just an important thing to do.
Yeah, and along those lines, diagnosis. I remember when I was diagnosed, for instance, people are so well-meaning, but they have a lot of questions or they want updates. Do you have any advice to patients who are going to go through this? Did you like delegate, like, okay, mom and dad are going to answer these questions. I don't want to keep repeating myself. Did you have a system like that?
Oh, in terms of telling people about the diagnosis?
And yeah, the diagnosis and all of the updates, throughout treatment.
Yeah, I think it definitely, because young, it was just my parents handled everything. Like I only told a couple of my friends, but apart from that, my parents told everyone else that needed to know. So I think if it is someone younger, it is better to direct the more intense questions to the parents because I wouldn't want to keep repeating myself or thinking about it all the time as well.
Absolutely. Okay. So you had your right ovary taken out, you said, and
Yeah,
this cyst, or it turned out to be a tumor.
yeah, yeah. I had that removed as well.
So do you know, so how long after the surgery did you get the results of the surgery, what they found?
So it was 3 weeks later. I know that my parents were told about it earlier, but I think they wanted to give me time to recover. So on the day that I was being discharged, that's when I was told, because I was healthy again, as healthy as I could be.
Right, you were recovered from your surgery mostly.
Yeah. Yeah.
Okay, so I'm looking here. So your surgery was, um, I'm actually a little bit confused with the dates. So it said June 5th of 2011 was the surgery.
Oh, sorry, I meant Jan.
Oh, January. Okay, okay, gotcha. January 5th. And then you got the official diagnosis. It says 20/5. So I'm just,
Oh, yeah. So the 20th of. Oh, sorry. I was just quickly typing it before,
no
so
worries.
I'll resend you the dates. But so it was about the end of the month of Jan. Yeah, so about 3 weeks from when I had my surgery.
Got it. Okay. And so you were still in the hospital, and was it that they wanted to keep you in the hospital until you were recovered and or until they had the actual diagnosis?
I potentially think it was both, but I definitely needed the time to recover because I remember the day I went home, I was, just almost ready to be back to full health, but I wasn't quite there yet. So, yeah, I think it was a bit of both.
Gotcha. And so if you could walk us through how they told you the diagnosis.
Yep. So, yeah, this is a day I remember quite well. So I was sitting in this white room in a conference room with my oncologist and one of the other doctors, and then my parents and one of our family friends who's also a doctor. And basically, I don't remember it that clearly, but my doctor just told me that what they'd found from the biopsy was that I had stage 3B dystrominoma. It's a form of ovarian cancer. And yeah, so that's how I was told.
Do you remember, I mean, it's like a lot obviously to swallow in that moment. Do you remember how you reacted, what was going through your head at that time?
Yeah, I think I can definitely say it was very overwhelming. And I just almost it felt like time slowed down and all I could hear was the word cancer. And like I said, I don't remember anything else except that word from the moment. And I definitely felt very scared, but also reassured to know that I had a really good medical team and a really good healthcare system and all of the best medication being provided for me. So I think that definitely made me feel better, especially being so young. You kind of have this belief that everything's going to be okay and that medication will always help you, as it always had helped me in the past. So I thought this was kind of the same thing. And I think I was in a state of kind of shock, and I only really felt the true emotions of it as the months went on and realizing how it affected my life. Because I think the diagnosis itself is scary, but realizing how much it affects you, that's when you actually get to react to the diagnosis.
Okay, gotcha. Meaning when you realize when you're processing how your life is going to change is when it
Yeah,
really hits you.
yeah, yeah.
Okay. So you and your family, of course, are taken aback by this news. And then do they discharge you? What do they tell you about your treatment, your chemotherapy at that point?
So they said they would discharge me on the day, and then I'll come back about a week later and they would discuss my chemotherapy treatment plan at that point.
Can you describe, I mean, I'm sure it's a lot. You go home for a week. Describe how you're able to, mentally stay, like you're processing everything. How were you able to handle everything in that week?
I think I didn't. I remember going home and it was a really beautiful day, and I just felt annoyed because I just felt like my entire life had changed and everyone was going about their lives as normal and just like still recovering from the surgery and adjusting to the fact that I had cancer and that my whole life was going to change. I think I found it really difficult, but at that point, it was really nice to have the family support and extended community support. And I think that really got me through all of it, and yeah, not just that week.
Okay, gotcha. So you go back into the hospital, I guess, for your appointment with the oncologist. Can you describe that day? What he or she was telling you about your treatment?
Yeah, so I just went back in. It was pretty clinical. So they told me the types of medications I would be having, and then how often I'd be having it, and then when I'd be having my blood tests and my scans. And yeah, and that was kind of the process. And open the floor for me to ask any questions and things like that.
Were there any questions you wish you had asked at that point? I guess sort of advice for people who are heading into their first appointment with a diagnosis.
Yeah, I wish I had asked questions about my fertility because that was obviously something, having ovarian cancer, that would be affected. I wish I'd asked questions about my hair and hair loss and how that was going to go and what they kind of expected from that. Also, just anything I could have done additionally to treatment to help myself. And the question I wish I'd asked the most is about getting support for my mental health, because I think it's a thing that I didn't think about, and I potentially was briefly asked it throughout my treatment, but I wasn't open to it, and I wish I just known what was available to me to support me in that way.
I'd love to talk more about the mental health piece of it for sure. I think we'll spend quite a bit of time on that. So before we get there, let's just talk about that treatment plan that you were assigned, essentially. What was it? How long would you have to undergo treatment? And how many cycles, how many hours of infusion?
So I had Bleomycin and Carboplatin, which are the two chemotherapy drugs, and I would have them 3 times a month. And then, so each was about the 3 hour cycle per day, and it would be a mix of both of the chemotherapy drugs.
So was it 3 days in a row, or was it one day and then you waited a week and then another day?
It was 3 days in a row. So I think it was about Wednesday, Thursday, Friday every month for 6 months.
Gotcha. Okay. And you got a mix of the drugs every single one of those days.
Yeah.
Can you describe the infusion? First of all, did you get like a port or a PICC line, or was it all through an IV?
I got a port inserted at the start. So I think when I went back a week after the surgery, that's when, sometime around then would have been when I got the port inserted.
Any sort of tips to other young, teens about the port process?
I think it depends on your level of comfort with, I guess having something inserted. And because I was relatively okay with medical procedures, I found that quite all right. But like, there's no pain. You're under anesthetic. You're not going to feel anything. It is a little bit sore after you wake up, so you might feel, some pain there. But apart from that, it's a pretty easy process. And I guess it's just a bit weird because when you do have the infusion, they do put a needle into the port and they do numb it as well. But it's just a weird thing to see. Like, it's such a large needle being inserted into you. But the whole process should be painless. And if it's not, that's definitely something you should talk to your medical team about.
Okay, great, great advice, because they can always up the numbing medication and
Yeah.
do different things. Okay, so can you describe when you started to feel side effects from the chemo? And by the way, were you inpatient? You would stay in the hospital for 3 days essentially, and then go home after, or?
I'd go home after I was finished my treatment. So
Oh,
do the 3 hours, then go home.
and did you get blood labs or blood tests done before each infusion, or was it just before the first one?
I would have it done, yeah, before the first one.
Okay, and did they explain why they did that?
Yep, just to check that my immune system was healthy enough and was able to handle the chemotherapy treatment.
Okay, perfect. And they used your port for blood draws too, right?
Yep.
Okay, great. So yeah, can you describe when you started to feel side effects from the chemo and what they were?
I think about 2 weeks after, or a bit earlier, about a week after my first chemo cycle, I started definitely feeling the fatigue, to the point where just like taking a shower, I could not stand up for the whole shower because I'd just be so tired. I also felt like bad breath was just a part of it, which was just a not very nice side effect, and also my nails turning grey. And I also did feel nausea in the first one pretty badly, so I was throwing up, but I did get put on an anti-nausea medication, which helped incredibly for the rest of my treatment. So I didn't actually feel, I definitely still felt nauseous, but I didn't have the throwing up. Yeah, so I definitely think nausea and fatigue were my two biggest symptoms.
Okay. And so I guess one advice there would be ask for anti-nausea medication. I've heard people say they've been advised by nurses to take it even before they start feeling anything. Is that what you did too?
Yeah, I did that too. So when I was starting my treatment, that's when I would take the anti-nausea medication, and definitely helped. And yeah, like I said, it should be a relatively painless, nausea-free experience, and the medication is there to help you.
Okay. Is there anything, did the side effects get better or worse as the cycles went on?
They were relatively the same, except, yeah, like I said, for the nausea got better because of medication. But apart from that, the fatigue was there the whole time.
Okay. Was there anything else that sort of helped you through the chemo, the treatment?
In terms of
And
physically,
yeah, physically and also maybe just support wise at that time.
um, physically, I think it was just having good open communication with my medical team and being updated on what was happening. And in terms of socially, my mum came to all of my appointments, and that definitely helped. I don't think I could have done it without her. And having a good support network, I think, was the most important thing throughout it. So not just my family, but also having friends that knew what I was going through and being able to talk to them about it.
Okay. Yeah, absolutely. It makes a big difference. I'm seeing here that you did lose your hair from the chemotherapy and it says February. So do you remember, was it just like a couple weeks after your first infusion?
Yeah, so it was a couple of weeks after, and that was when I first started losing it. So it wasn't all of it, but then, so I think a month after my first treatment, that's when I noticed that it was really falling out of my scalp. So you could see it coming out of my hairline. And that was definitely one of the hardest things throughout the cancer journey.
Yeah, can you describe what happened with the hair and what made you decide to finally cut and shave your head?
Yeah, so when my hair was falling out of the hairline, that's when it was very noticeable and I couldn't cover it up anymore. And so I that's when I decided just I needed to shave it off and I'd rather have a wig instead.
Okay. Is there something about sort of for you the decision of, okay, I don't want to let my hair just fall out. I'm going to take control over this. Was that part of your decision?
Yeah, definitely. Okay, I think it was more that I didn't like how it looked and I knew that there was no way I could hide it anymore. And if I wanted to look more normal, I guess it would be best just to get a wig.
Gotcha. So who shaved your head for you?
The lady at the wig store.
Okay. Any advice or tips to people who are nervous about the hair loss portion of this chemo side effects and how it helped, how whatever helped you through it?
I think it was that's so hard. I don't know what I think would help. I think just knowing from an early stage that this was something that was going to happen and just grieving the process of losing your hair because it's something that I think we take so for granted and giving yourself that space to think, you know what, it is, just hair, but it is really an important part of, the way that you look. And it's okay to be sad about it. And I definitely had more than one cry about losing my hair. And I think just being open and how you feel about it. And I wish that's something I had done more of and talked about it more to other people. And yeah, I think definitely getting a wig helped a lot.
Okay, great. That's great advice. So your chemotherapies, when were you, I guess you got a scan done before you started chemo, and then it says monthly for a year. You had to get a scan done every month?
Yeah, so would have an ultrasound and blood test every month.
Wow. Can you kind of walk us through the process of having to go through a scan every single month?
Yeah, so I'd have to have an ultrasound every month, which meant I'd have to drink a lot of water before. So that's how the scans work. So, and the best way to do this for anyone who's going to do it is to drink, I think it's about 1.5 liters, about an hour before your scan. So then when you have your scan, you're ready instead of just drinking lots of water right up until your scan, because you'll have your scan and you'll just really need to go to the toilet and it's not a fun experience. And yeah, so if you Google it, it should also help you with how much to drink.
Okay. The actual process itself took not too long. How long was the ultrasound?
Well, the ultrasound was about 20 minutes. I'm pretty sure.
Okay. And what were they doing, if you could describe the procedure?
So they would scan my lower abdomen and then just look around at my one ovary that was left, and then where the space where the other one was, and just looking for any cysts or any abnormalities there.
Okay, this was all throughout the year through chemo and after?
Yeah.
Okay, and so did they explain to you or your parents at the time the reason why they're doing this is because sometimes it then spreads to the other ovary, or what was the explanation there?
Yeah, so they just said they needed to keep following it up because during the period, especially after I stopped my chemo treatment, to see what was happening and to see that if the cancer was coming back. And or if any other changes were happening that they needed to get ahead of.
What was the point where they said, "Oh, it looks like you have no evidence of disease"?
So 6 months after my treatment, that was officially when I was in remission. So that was, there's no evidence of the disease. So we're not going to restart you on any sort of treatment, and we're just going to keep following up and go from there.
Okay, and the follow-ups, what were those? Were those scans, blood tests, just checking around physically?
Yeah, so the follow-ups would be the ultrasound and then a blood test every month, and then I'd also have an appointment with my oncologist. And then so I had them monthly for about a year, and then it went down to 6 monthly for the next year, and then yearly, and then 2 yearly. And now I'm done with all of my appointments and scans and treatments.
Oh, great. So you don't have to do the follow-ups anymore.
No, I don't have to do any more follow-ups.
That's wonderful. Congratulations on that.
Thank you.
Do you remember what year it was that just completely stopped?
Yeah, I think it was the start of last year.
Okay, so it'd been like about 10 years or so, maybe.
Yeah.
Almost. Okay. So there are a lot of different, I mean, first of all, when you heard finally no evidence of disease, that must have been like, how did you react? How was your family?
When they told me, my parents were ecstatic. They were obviously so happy that this was all kind of coming to an end. And I think it was interesting because when I think about this experience, I remember sitting in the room and then telling me this news, and I almost felt nothing. Like I knew I was supposed to be happy, and I was happy that it was over, but I didn't feel the sense of happiness. I just felt the sort of emptiness because I think, you go through this whole process that's incredibly life changing and so emotionally draining, and you don't even have time to stop and think about how you're feeling. And then all of a sudden, it's like it's over, and everyone expects you just to go back to your normal life and be the same person when you're really not. Not to sound very dramatic, but yeah.
But you bring up a great point that a lot of survivors talk about, which is once treatment's over, it's not just over. In fact, for a lot of people, there's a lot of work ahead. So for you, how did you? I mean, especially because you were going to get scans monthly, so that must have been on your mind. Like, well, I'm still having to come back to the medical treatment center all the time. How did you mentally, and emotionally get yourself through that time? How did you process?
Um, I think I didn't really emotionally process it, to be honest, because I think I felt this sense of, like I said, wanting to go back to normal and wanting just to be the same person I was before this. And I think the only thing that really helped me through it was just having my family support and my friends support throughout it.
Did you find that you had to ask for support? I mean, especially when you're young, say with your friends, it's kind of, they don't understand what you're going through. What helped you sort of get them to understand what you were going through as best you could and ask for help from them?
I honestly, looking back, I don't think I asked for help enough. So, if I was to ever do it again, hopefully never, but I think I would definitely put in place a lot more mental health support systems and be more open to actually talking about what I was going through, because it's definitely something I didn't do enough of when I was going through it.
So that means talking to more people. Does it also mean like a psychologist, a therapist, a counselor? Like, do you wish that would have been in place for you at that time?
Yeah, I definitely wish right from the start I was talking to a counselor or therapist or someone in that kind of field. Even if I wasn't feeling the effects of it yet, it was something that I was definitely going to feel and continue to feel after it was all over. So I think that would have been important. And yeah, just having more open conversations with my friends and my family about what I was going through.
Okay. Yeah, that makes sense. And in fact, another thing we didn't talk about was that you were still going to school during this entire time, even when you're going to chemo. Can you describe how you were able to juggle all that?
Yeah, I mean, I think it really helped because the school was very supportive of it. So they were open to me taking breaks or being able to go home in the middle of the day. And also the nausea medication honestly helped so much because without that, I definitely would not be able to go to school. But I think overall, how my body responded to the chemotherapy, that was the biggest thing, that it didn't have this major effect on me. So I was able to continue doing things like that.
How was it, going to school and then you had lost your hair? I know you had a wig, so that was helpful. Is there any advice to other people who are that age who might be a little bit nervous about transitioning from, having the hair to then having to use a wig or a hat?
Yeah, I think Looking back, I definitely would have looked into more options of having wigs because it is quite a wide range, and having something that's more secure because like when you're in school, you're moving around and you're going to PE and you're doing all that kind of thing. And just having a wig that's secure and makes you feel comfortable and, beautiful, I think is important. So, actually putting some effort into that because it does matter, and how you look does affect how you feel, and, not writing it off as something that's not as important as any of the other things that you're going through.
Absolutely. And it brings up another question too about your immune system, because with chemo, of course, your immune system usually is compromised. I mean, did you have to take some time off of school, a couple days here and there to let your immune system recover?
Yeah, there was. I definitely think I would have taken a couple of days off throughout the 6 months, but overall, it was okay. My doctors were definitely nervous about it because if I got any kind of illness, it would be really bad. And I think that was just a risk that I was willing to take because I needed to have that routine. I needed to have school to feel normal and to get through the treatment. Because I just don't think I would have gotten through it if I had to stay home or do something different.
Okay. I just have a few more questions left, but one of the important ones that you'd brought up before was about fertility. Of course, at the time it was 13,
Yeah.
and so you're not thinking about that. What has that medical experience, what kind of impact has it had on you? And, what have you learned that might be helpful to other people in that situation?
So personally, for me, my fertility was, I guess, a difficult experience throughout all of it. And I think it was just hard not knowing a lot of the time, and the uncertainty that cancer brings is definitely a difficult thing to embrace. And I think what I've learned from it is, I guess, a couple of things, because I think when I was going through it, I realized that thinking about losing my fertility impacted me so much because I think so often we tie femininity to fertility and we think losing one means losing the other. And I guess learning that those two aren't as interconnected as we are told to believe, and just realizing that, even if I didn't have my fertility, it doesn't make me any less of a woman or feminine, and doesn't mean I can't have children. And I think trying to learn that at a very young age was very, very difficult. And I think, again, in that point, it's important to have those conversations with people that you trust and with your medical team about the best kind of steps you can take forward.
Okay, that's great guidance. And you don't have to share if you don't want to, but I mean, is there anything that you've done since in terms of the fertility, or like, just to address the fact that you had one ovary removed, or is that not necessary?
So, along with the ovary being removed, I also have polycystic ovarian syndrome, which I don't know if everyone's heard of it or not, but that does also affect your fertility. So, I was on medication for quite a while to help with the symptoms of that. And now I'm kind of being told that I don't have to take any of the medications, and that I should be okay to have children if that's what I choose. And yeah,
That's wonderful, just so that you have your options. What was that terminology? What did you have?
I have polycystic ovarian syndrome.
Okay, what is that? What were you feeling? Was that right after your treatment?
Yeah, so it's basically a syndrome, which means that there's an imbalance of hormones in your body. So you have slightly more of the male testosterone, and then that's normal for normal women. And yeah, so the symptoms that come along with it are typically things like you might have excess hair on the face, darkness, and like hyperpigmentation. Those are the two that kind of stick out the most to me with that.
How long did that last for you?
So it's typically something that it's just a syndrome, so you might have it forever, but there definitely is medication that's out there to help with the symptoms of it.
So for you, after the medication you took, it went away, you said, or you stopped taking medication after how long?
I About 9 years after I started taking medication, so it definitely was a very long time.
Did that have any side effect, the medication you took? Like, was it a pill every day or?
Yeah, so I was on a contraceptive pill from when I was 13 till about last year. So I think that definitely had an impact on my mental health and how I was feeling. And just because I was on it for such a young age, it was hard to tell what was baseline for me and whether how the medication was affecting me in terms of my mental health. So I think that's something that's really important to track if you do start taking medication like that.
Okay. You've done such a great job bringing us through your experience. I think some people who are going to be watching this are going to be parents too, who might be wondering how to help their kids because they don't understand that perspective. So now that you're a young adult, what would you say to parents in terms of, and I know everyone's different, but in general, when someone who's so young is hit with a diagnosis, is there anything you could tell them to help them out in the situation?
I think just being supportive and open to listen to things, and you know, reminding them that it's okay to grieve the process and okay to be sad throughout it. And I think you're just creating those safe spaces for your children to come and talk to you, but also giving them that space to adjust and heal on their own, and not wrapping them in cotton wool and making sure they can't do anything. Because like I said, having a routine and having a normal life was such a big part of my recovery, and I don't think I would have recovered as well if I didn't have that. So still letting them do the thing as much as they can do, um, as long as it's being safe, I think is really important.
Okay, so don't treat them too fragilely because that could really hurt the recovery process, mentally and emotionally. Um, were you a question asker? Like, I'm wondering at that age, if there's a balance between parents. I mean, parents obviously have to make the decisions, but in how you and your parents even talked about treatment or what was going to happen, you know, is there any advice there in terms of the open communication you talked about?
Yeah, I think just with the medical team being so open about everything that's happening and helping me make those informed decisions is important, because although I was young, I think it's important to have a voice in the treatment and knowing at all points what is happening and what's going to happen next. And I think just making sure that they're a part, the child is a part of the journey too.
Okay, yeah, and go with me. Anything else that you wanted to add about, I know you're an advocate, and you speak out about your story to help other people. What else is important to you for others to know?
I think a lot of the advocacy I do now around ovarian cancer is just removing the kind of taboo when we're talking about women's bodies, because I think that was a big barrier for me to talk about some of the symptoms that I was experiencing, just because there is this sort of shame that's so tied to having feminine problems and even having issues with your fertility, and when they just shouldn't be. So I think it's about really normalizing that, and even with parents and children, normalizing the kind of thing, how you talk about your body, the names that we call our body, and just being able to have those open conversations. Because I think if I was able to have more of that growing up, I would have been able to talk a lot more sooner about the symptoms that I was having. And it's obviously not one person to blame, it's just a societal issue that we do have, that we struggle to talk about things that are wrong with us, especially when it relates to your vagina or your ovaries or things like that. Like, it's very hard to speak about.
Yeah, and actually, it'd be really, I think, powerful to hear an example of one of the situations where you felt like there's not enough awareness about how people talk about these things. Um, what is an example of one of those changes you want to be making when it comes to how people describe the experience and the after effects?
Sorry, you might have to repeat that question.
That's okay. So you're talking about how you have wanted to really advocate when it comes to ovarian cancer, for instance, in women, this like body image topic, feeling less than a woman because of the body parts involved and the side effects that happen. And so I was just hoping that you could call out one of those specific examples.
And like, yeah, I guess just the point I made before about calling body parts what they are instead of giving them nicknames or euphemisms, because that kind of inherently implies that something's wrong with them. And I think that would have been a really important thing to have, to just calling body parts what they are, And I think especially describing that even to children when they're younger, and helping kids identify what's normal for them and what's different. So what's how your body should be functioning. Because if I knew what my baseline was, I would have known that I was way off my baseline when I got diagnosed. And that would have really helped me getting diagnosed earlier.
Gotcha. So just overall, better using the words that are just what are supposed to be used. So you're saying people aren't open to talking about ovaries and vaginas and stuff like that. Is that essentially the bottom line here?
Yeah, that is, yeah, definitely what I'm saying. And I think even the conversations that we have around fertility and the importance that is so tied to it, and reminding ourselves that it's not everything.
Absolutely. Okay. Any last thing you want to say to people? Maybe just one message. Obviously, you look amazing. You have great energy. You're now like living your life out there. So you're on the other side of things. Do you have any message to people who are still just starting or in the thick of it?
Um, yes, I feel like because I was looking through the template, and I think my kind of thing is, like, I'm not gonna lie, cancer is a really tough experience, and it has its highs and its lows. And, there's going to be days that are terrible. And I think it's just about giving yourself the space to grieve and the space to experience it. And just, it's your story and you get to choose how it goes. And just giving yourself that time to adjust and being kind to yourself and knowing that it's only temporary.
Thank you so much, Gautami. Really appreciate you sharing your story with us today.
Awesome. Thank you so much for having me.